Thank you for the presentation. Yes, I am a researcher at the Norwegian Institute for Air Research, and we are part of this consortium that it's glued together at the European Topic Center, and we are actually responsible, together with the environmental agency, for the health risk assessment that has been published and actually very much well versed by Joana in the last presentation. This talk is actually to understand, as once again Joana very well explained in her presentation, how the new WHO guidelines have been released, and then we wanted to know how much they will impact our.
Excuse me, Dr. Soares.
Yeah?
We don't see your presentation. There is a shared screen, but no presentation.
Okay, I thought that was. Can you see it now?
No. Oh, yeah. Now, yes.
Yes.
Perfect.
Okay. Interesting. So anyway, very easily to understand that our motivation, once again, is just we know that particulate matter is responsible globally and at European level for respiratory diseases, and not only, of course, morbidity, but the mortality that is related to this exposure, as we had published maybe 3 weeks ago via briefing at the European agency. 373,000 premature deaths are expected because of 2019 levels, air quality levels for PM2.5. And we know that if you just look at this histogram, this is an histogram for the annual mean for PM2.5. You can see that, as Joana also explained, that if we look at European limit values, there's very few places in Europe that are above this limit value. But if we consider the WHO air quality guidelines, both 2005 and then the new ones, we can see that the picture is very, very different. And this is our motivation. So our aims are to assess the impact of this new air quality guidelines, and also to understand the potential health benefits for European citizens overall if these levels are achieved. So to start with, we want to explain you the methodology behind our calculations. It starts with air quality maps, and we take rural background stations data, also suburban background and traffic air quality data. And because, of course, that they are not everywhere in Europe, we need to have another support. We support with the EMAP model and other sort of data like orographic data to create via linear interpolation, linear regression and spatial interpolation to create a map on 1 kilometer square. And then we use this concentration map across Europe together with the risk functions. And at the moment, we only use the old, let's say, the old guidelines supported by WHO that are described in RAPI report. We use those risk functions for particulate matter, fine particulate matter, ozone, and nitrogen dioxide. We also use demographic data, so population, but also data on mortality and life expectancy. And then we calculate our health outcomes. And here currently we only calculate mortality related outcomes, that is premature deaths and years of life lost. I would not bother with the details of the different formulations that I show you here, but I wanted to say that for each of that grid cell, we calculate the risk related to the concentration at that grid, and also the population that lives in that grid. And then after we calculate for every grid cell, we then aggregate for at country level. Also to keep in mind that we sometimes do not have all the data that we need in terms of health data. So sometimes we have to gap fill, and normally we gap fill that data with neighboring countries that have similar social economic standards. We also need to keep in mind that there are associated uncertainties to these calculations, starting with the concentration response functions that are, when we get these functions, they are set for those specific epidemiological studies, but then we use it across Europe. We also have to think that the contrafactual concentration, so the lowest limit, the lowest concentration level that we assume that there is some impact on our health, it's an imperfect knowledge. We have to think that this gap filling might introduce also some uncertainties, and we also have to think that we only calculate for a single pollutant, but they do exhibit some sort of correlation. But WHO does not recommend that we add up this constant pollutants because we can double count. So coming to the results for 2019, and if you look at these briefings from the environmental agency, you probably have seen these maps already. But on your left side, you will see the premature deaths across here. There's 41 countries that they are calculating the health outcomes for. You can see that on darker, you will have more premature deaths, and in lighter blue, you will have less premature deaths. Typically, this will happen that higher numbers are for the countries that they're more populous, and the lower numbers are for countries that have lower population numbers, but also lower concentration. The years of life lost map will be very similar to this number of premature deaths, but plotting it by scaling it to the number of inhabitants, we will see that the picture shows it's very different. So it turns out to be very different. So it means that if we scale it through the population, we see that the highest impact will be in central and eastern side of Europe. So coming to the point that how much will change with the new guidelines. So as also discussed previously in the previous presentation, there will be a big change or relatively big change in terms of concentration response functions. And this change, and I show here a table using the guidelines or the recommendations actually that is set in 2013 and the new ones. The numbers are very different. So on top, you'll see here the calculation, and this is the interval, the confidence interval of that risk function. We will see that the changes in concentration response functions might increase the health outcomes at least in 26%. And this is pretty, every country this will happen. So it's pretty stable, let's say. But if we look at the counterfactual concentrations, so the minimum level that we assume that there is a health impact, things are very different. Now we will see that we first assume that all the concentrations would have an impact with the new recommendations only above 5 micrograms per square meter. That means that in general, the outcomes will decrease also 26% or 25%. But this is in a general. We will see that across, actually, this will impact differently than from country to country, because countries, for example, in the Northern Europe, where you see that there was very low impact, it means that their annual concentrations are very low. This change will not be affecting them. Actually, probably they will have very low numbers in terms of premature deaths and years of life lost. But it will impact differently for countries that have high concentrations, because their numbers will most definitely they will not decrease, and with the change of the coefficient, the risk function, increasing, that means the number of premature deaths and years of life lost will increase in the next assessments. So how much will the European population will benefit if the levels are attained? So again, here I just show you the map before on the premature deaths across Europe. But here then I show the benefit if this new air quality guideline levels will be attained, meaning this 5 micrograms per square meter. And this health benefit means is the percentage of premature deaths that will be avoided. So then you can see that in dark, we will have over 70% in benefit. And the lighter, of course, and as expected, will be in the Nordic countries, will be around 10%. And you will see that in general, we would benefit 58% if these levels will be attained. In comparison with the 2005 guidelines by WHO, meaning the 10 micrograms per square meter, the benefit will be much lower. So these are the two values to consider. Going forward, and then to conclude, we can still say that the health impacts due to exposure to air pollution across Europe remain high, in particular in Central and Eastern European countries. With the changes of the guidelines or the recommendations from WHO, where we will have different concentration response functions and counterfactual concentrations that will impact the estimation of the health outcomes. The new recommendations definitely will change the estimations that will be published in the future, and they will probably be considerably different for countries with high annual means for PM2.5. And we already knew that by attaining the levels in 2005, according to the WHO guidelines, we would have a reduction of a bit less than 30%. But now with WHO latest guidelines, we would reduce around 58%. And with this, I want first and foremost to acknowledge all the countries that report the observation data to the EEA, Environmental Agency, through the e-reporting, and all the work that was funded obviously by the European Environmental Agency and the Ministry of Climate and Environment from Norway. And by this, thank you all for listening to this presentation, and I'm open to questions. Hopefully I didn't extend too much my time.
Thank you, Dr. Soares, for your interesting presentation. I ask everyone if they have some question. Please, both the one remotely connected.
I think Joana has a burning question.
A burning question. Please. You can hear me now well, right?
Yeah,
yes.
Perfectly.
Now, I apologize. Logging off and logging on helped. Thanks for a very nice presentation, Joana. Just a comment on using of the old response function 1.06. I think I read in this report that you will use the new one from 2022. And yes. Why not now? I mean, this has a major impact on policy next year. And also comment on NO2, this baseline being set at 20 micrograms, right? And we believe that this really underestimates the number of deaths due to NO2 in a major way. Yeah, so that's my questions.
So we just had the briefing published, so it was on the cusp of that of the guidelines being released. So we didn't really. I think we needed to give ourselves time, and we are about to hopefully publish a paper on the methodology and also the impact of using what we were using before and what we are now expecting, so people get to know what is the difference. I mean, why now EA is publishing something that will impact, as again I say, countries with higher concentration, annual mean concentrations, and I think it will be daunting to see those numbers and scary to see those numbers. So we need to like saying why you're seeing these numbers and explain them in a crystal clear manner, in a peer review manner also, what we are doing. So we are, and all the assessments, we also publish a ATC report where we do a little bit of that, show a little bit of this analysis too, how much it impacts in especially the counterfactual concentrations. We've been publishing a little bit on that to show that yes, we are aware, but at the same time, we don't feel we have to stick to what the recommendations are. So we are in this position that we cannot go on our own and set up the different levels. So we are pleased that the WHO has released new guidelines and move forward from there and publish as soon as possible with those new numbers. Yeah.
Okay, very good. Thank you. And is this what you presented today? Is that published anywhere, or was one?
So it will be. So some of the results are published in the ETC. I can actually link it to the chat.
Beautiful. Thank you.
And hopefully we will have a publication soon.
Okay.
Yeah, cross fingers. But,
excellent. Thank you for a very nice presentation.
Thank you.
Thank you, Dr. Soares.
I guess I don't see any more hands raised, or?
Okay, any other question? Oh, do you consider that new regulation have a scientific base and social development support to be achieved in the future? Who is asking? Is it Belaxen? I did. From Romania?
I mean, yes. Of course, I mean, this would not be implemented otherwise. But this has been, I participated in the discussion where the European Union was discussing the new implementation of for the revising of the European limit values, etc. And this is something that it will be hard, especially for some countries to attain. So I think the social development support part, this is where it needs to be discussed. But it is based on scientific studies. So we just have to we accept them as the new baseline for our work. And hopefully the Commission will create the tools for countries that need the most to improve and to and reduce the exposure we have to harmful pollutants.